Group 1. My name is Alexis Pomavin.
I'm Isabel Zubia.
I'm Ricky Baeza.
I'm Alexia Cuevas.
I'm Selena Samaniego.
I'm Monica Veleta.
And I'm Evelyn Vasquez.
Sleep-related infant deaths include sudden infant death syndrome, accidental suffocation and strangulation in bed, and death from other unknown causes. Although we can prevent unknown causes, there are some ways to keep your baby safe while sleeping, both at night and during naps.
Place your baby on his back at all times, never on his stomach or side. Never share the bed with your baby. There's always a risk of accidental suffocation. It's always a better idea to place your baby on his crib or in a cot next to your bed. Make sure the mattress of your baby's crib is firm and it's covered by a fitted sheet. Remove all soft objects from the baby's sleeping surface, such as pillows, loose bedding, or stuffed animals to prevent suffocation.
Choking hazards. Infants learn about sensory qualities such as shape, density, texture, and taste through their mouths. This is known as mouthing. Although this is a healthy form of discovery for the baby, this also can put the baby at risk of choking hazards. Hopefully it never comes to it, but knowing how to perform emergency choking first aid and CPR on your baby is essential, as time is the most important factor if a choking hazard were to occur.
First, the best thing to do is make sure that any items that may pose a choking hazard for the baby are not within reach or locked away and out of sight. So like coins, small marbles, toys, etc. Always cut up food such as grapes into smaller bite-sized pieces to avoid any large obstructions while feeding the baby. If a choking hazard were to occur, these are the steps to perform choking first aid on your infant. First, grab your phone or tell the closest person to you to call 911. Gravity is your enemy here, so you'll want to keep the baby's head as far down as you can possibly safely hold them while placing the baby's stomach down across your forearm. Give 5 quick, forceful blows to the baby's back with the heel of your hand. Hold your baby's head and then rotate them up against your body to check for the object while still keeping the head below. Repeat these steps until you have successfully expelled the obstruction or the baby starts coughing or crying.
If these actions do not work and the baby stops breathing, then CPR will have to be performed. Begin thumb compressions on the center of the baby's chest, just below the nipple line at about 1.5 inches for about 30 chest compressions. Open the baby's airway using the head chin lift technique and give 2 breaths. Ensure each breath makes the chest rise and allow the air to exit before giving the next breath.
Continue giving sets of 30 chest compressions and 2 breaths until you notice obvious signs of life. An aide is ready to use or another trained responder is available to take over. Remember, do not perform these actions if there are obvious signs of life such as crying, coughing, and produces sound, breathing, and cautiousness.
Taking local CPR classes near you is a great way to become certified and trained in life-saving measures.
For the first year of your baby's life, proper growth and development is important, which is why starting good eating habits earlier will help set up healthy patterns for life. Babies know when they are hungry or full and will signal and give you signs when they are.
Number 1, milk. Whether it be breast milk or formula, you will want to give your baby milk for at least 6 months and preferably up to 12 months. Milk contains all recommended nutrition needs for your baby. At about 6 months, you may start introducing purees, soft food, baby cereal, and solid foods. By the time your baby is 7 to 8 months, they can eat a variety of foods from different groups such as banana, oatmeal, yogurt, and etc.
Number 3, signs that your baby is ready to start on solid foods include sitting with minimal support, head control. This is when your baby is able to hold their head upright and steady for about 15 minutes. Reaching and grabbing, where your baby is able to pick up objects while seated and bring them to their mouth. And interest, meaning that your baby is interested in food, especially while you're eating.
We are Group 1 covering infancy. During infancy, there are many ways you can keep track of your baby's development. According to Erickson's stage of development, infants are in the trust versus mistrust stage. There are sensory motor stage of Paget's state of development, and lastly, infants are immoral according to Kohlberg's theory of moral development. We wrote a poem to help you remember. The title of our poem is Baby Shakespeare.
For me to trust, feed me, bathe me, love me.
Be there for me, you must, or I will mistrust.
All these senses around me got my motors in a shuffle.
Brush your finger against my cheek, and I will seek and suckle.
Because it pleasures me, so I may kick, scream, and laugh, so you'll just have to chuckle.
You see, I know I lack some morals, but I hope we won't have any quarrels.